pediatrician here at Choptank, and I take care of both well children and also sick children. And I think the pandemic has affected both of those areas. Well children have come in a lot less frequently, or when they're due for their visit, they're sick. You know, everyone's asking screening questions, and I think there's been a lot of fear of, like, if I answer yes to one of these questions, will my child still be seen? But that's basically every day I'm taking care of children, whether they're well or sick. I think, you know, in the beginning, people kept saying, oh, the silver lining of the pandemic is that the children are well, the children are spared. And I think one thing that wasn't really a shock, but as the pandemic kept going on, you realized how it's impacted families in more ways than just those that have been sick with COVID. Obviously, there's the economic impact, but obviously the mental health of the children, development of the children who aren't in school and they're not seeing their teachers and their peers, and even the masks that they're wearing, like all of that, the children have been so impacted by COVID. And even when the bars and restaurants were opening back up, schools were still closed, it was impacting them in that way. And then now with the Delta variant and seeing more children being sick, more children are hospitalized now than have been at any point during the pandemic, we're seeing more impacts on the children in every area of their lives. So generally, the majority of the children that are going to get sick are going to be just fine. But some children are hospitalized. And some children are having long COVID. You know, they talk about long haulers COVID with adults. Children, we're seeing that as well, that are having long-term impacts in their nervous system, emotional, depression, anxiety related to the COVID, also shortness of breath and sort of more fatigue than they were having. The scarier thing with COVID for children is MIS-C, or multi-system inflammatory syndrome in children. And it's scary because the children have been exposed to COVID, but most of them were never sick with COVID. They were asymptomatic, maybe never even tested positive, never sought medical care. And then weeks later, they become very ill with inflammation throughout their whole body, vasculitis. Their heart is impacted. A lot of them have myocarditis. A lot of GI manifestations like vomiting and diarrhea, dehydration, and they end up in the hospital, sometimes in the ICU for over a week on many types of medications. And that's what's scary, that we miss the primary infection and then later they show up very sick. Our numbers here are pretty low. The infectivity rate in Caroline County right now is around 4%. So we're seeing many sick children. I'm sending out dozens of COVID tests every week, and we're only seeing about 4% come back positive in our area, which is good. But we're definitely seeing more than we were seeing earlier in the summertime. So the testing for the types of variants, the testing that I order here in the office does not test for different strains or the different types of the virus. The health department like randomly selects tests in labs and says, run this to see if there's a Delta variant here. So we are seeing it here. It's on the Eastern Shore. The last that I heard from numbers, close to half of the viruses, the tests that were tested for the variant, close to half of them were Delta. So we think it's about half of the COVID cases here. And so I have 3 children, they're all 4 and under. So I'm not in the boat yet of choosing to get my child personally vaccinated or not. I think it is a hard decision to make, and parents want always to make the best choices for their children, of course. And there are so many questions surrounding the vaccine. I really do think it's a safe vaccine. I actually got it myself while I was pregnant with my 3rd child. She's healthy, I'm healthy. But when it comes down to, will I get it for my children, it really is weighing the risks and benefits, and the risks for the population at large and trying to reach herd immunity, which you hear in the news, where the number of people vaccinated in our population is enough that it'll protect the unvaccinated, is definitely there to get the vaccine for that. And again, the fear of children ending up in the hospital with preventable illnesses and long-term effects from COVID and MIS-C, all of that really point toward getting the vaccine. So that's a question we hear a lot. Does the COVID-19 vaccine cause infertility or issues with puberty? It started on social media. There's the mRNA vaccines, Pfizer and Moderna, target a spike protein, which is found on the coronavirus. When you see the pictures of the virus on the news, it has those little like spikes in the furry ball. That's what the vaccine teaches your body to recognize. On social media, there was a false claim that the placenta has a similar spike protein. And so by vaccinating women, you're teaching your bodies to attack the placenta during pregnancy. It's just not true. There is not an overlap in the two spike proteins, and they have just found that claim to be completely false. So yes, not scientifically based that it should cause infertility. Many women have gone on to become pregnant since being vaccinated. Even within the trial for Pfizer, 23 women became pregnant during the trial. One had a miscarriage and she received the placebo. So she did not receive the vaccine. So not scientifically founded.
Misinformation.